Have you ever stopped to take a look at the map of Hamilton County? It is a very, very big county. This is Jolie Pfeiffer, who is with the Hamilton County Health Department, and Jolie all the time is sending different representatives from the health department our way to talk about how people can come to you to get health benefits and treatments and that type of thing, access. But now y'all are going out.
Absolutely,
to this big old county.
Absolutely, we're launching our mobile unit. It's going out into rural area parts of Hamilton County. We also have our homeless mobile unit. That's already out on the road and it's in our homeless encampment.
So you were sharing with me that the Soddy Daisy office for y'all is closing at the end of June?
Yes, June 30th is the closure date.
Okay, so this is going to launch now, this Healthy Living mobile unit, on July 1st. To get out there, what all is on the unit? What types of access can you bring?
The unit is pretty big. You'd be surprised. It's taken us some time to learn how to drive it and everything like that. They've actually been taking driving classes to make sure they can get around town. But it's a really big unit, and it has a full clinic in it. It has an exam room, a bathroom, refrigerator, all the things that it needs to do all the services we already offer. There will be no gap between the services of the Soddy Daisy Clinic closing and this mobile unit. It offers the exact same services. It's the same group of nurses that you know and love from the Soddy Daisy Clinic, just on the mobile unit.
Oh, that's nice. Because people do build connections and bonds with that team.
Absolutely. It's one of our main goals with our jobs here. We really want to make connections with the community to know that they have a safe place with us, because ultimately we're here for them and we're here to serve them. And so if we can keep you healthy and then your kids healthy and then their kids healthy, that's our main goal.
So you told me off camera that you're kind of focusing on the rural community. Is it just the Soddy Daisy area, or can people request you to come to their part of the county?
So right now we're doing 5 days a week. It's July 1st it starts off. So our program, they've gotten a fantastic schedule already lined up for the summer months pretty much. 5 days a week they'll be in Soddy Daisy, Sale Creek, Hickson area.
Okay.
As people get used to having that Soddy Daisy clinic closed. But we definitely, after the summer, we are open to new partnerships and we're open to new locations of anybody that would like to have us out. Basically, if you have the capability to have a mobile unit in the parking lot, you have electricity, you have places for other people to park, we're willing to partner with you and you can give us a call.
Okay, so when you say it's a pretty big unit, there's a lot of stuff packed on there. Who do you think will be coming to you? Like, are you wanting it to be something where you mentioned the summer months? If you have a you know, a bike fall or something and needs some stitches, comes to see you, or is it more for preventive stuff?
It's definitely more for preventative stuff. It's going to offer the STI screenings, your typical vaccinations, family planning, WIC enrollment, case management, and things like that. Even Tennessee breast and cervical screening programs. It can offer those type of services. But if you do get stitches, we do prefer you to go to an urgent care and get that done, because the services will kind of be a little different wherever they go, basically. And the schedule we posted on our website. It's already up, so you can see where we're going to be those 5 days of the week starting July 1st.
I think it's really good too that you mentioned the nurses who are going to be the same, and those connections that you always aim to make. But that really is important, because so much of medicine and healthcare is about conversation.
Absolutely. The nursing and all of our staff at all of our clinics, but our Soddy Daisy Clinic, those people have been there forever. They love that community. They know that community so well, and they've made those connections with those families. And so those families were obviously devastated when we said that we're closing our Soddy Daisy Clinic. We were devastated. It wasn't a decision we made lightly, but ultimately we feel like it's the best decision for Hamilton County. That way we can get out and meet people where they're at. We're going into the community. We're breaking down even more barriers than we already were before.
Yeah, it really might be even a better thing in the end.
That's what we're hoping for. We're excited. You know, they've got a great schedule and a great plan, and I'm excited to see where it goes.
So I'm interested too how invested y'all were as a team on the development of this mobile unit. Were the nurses consulted on what they wanted to bring and how the layout looked?
Absolutely. The clinical director was alongside the project the whole time, and to make sure we kind of met the needs of what we needed in Hamilton County, what our nurses needed to function, because obviously it's not as big as a clinic. You will be in tighter quarters, so you won't have like a full staff. You'll have about 3 to 4 people on the bus at all times, and so they all work together, and they're such a seamless group that you don't even notice the difference.
Okay, I'm going to leave then the north end of the county for a minute, and let's come back urban and then other areas too, because you do have so many satellite offices. So where else can people find you? And then y'all have, like, I get confused myself, Julie. I talk to you all the time, but y'all have kind of like a family clinic, don't you, in Chattanooga proper?
Absolutely. So we have our 3rd Street downtown Chattanooga location. That's our main campus location. It's our biggest location. It has every single service and program we offer on our website that you see. Those are all housed there. Then we also have our homeless clinic location, which is off of People Street down there, kind of by UTC area where the Chattanooga Chattanooga community is at. So we have that clinic, and then we also have our Birchwood and our Ottawa location.
Okay.
So we have multiple locations. Stoddy Daisy is still there up until June 30th, and all those services are still being offered up until that closure date.
Okay, and they're always going to say it. The main thing you want to do is take preventive steps for your health. So whether you're looking for vaccinations, flu shots, they're going to give all the time.
Absolutely.
Screenings, even if it's just kind of a listening ear, reach out to them and they'll have a resource to support you.
Absolutely, we're here for you.
All right, good to see you. health.hamiltontn.org is the website, and then there's the phone number for the East 3rd Street location. Watch for that mobile unit coming to Stoddy Daisy July 1st.
Absolutely, thank you.
West Yellowknife Trading Post has everything under the sun. Shop our wide selection of soaker tubs starting at $599. New versions of mini splits as low as $895. Don't pay big box prices, but hurry, limited quantities available. You better get it when you see it at West Yellowknife.
When you buy your eyewear local,